my name is Rachel Martinez Hernandez, and this is my video submission for the YouTube portion part of the nursing application for fall 2026 of Texas State. So the first question reads, why did you choose St. David's School of Nursing at Texas State University? How have you prepared for a program? So honestly, I was part of a previous nursing program, and essentially I was dropped because I failed to meet the grading criteria for one semester, and I didn't get a second chance. And I was looking at all these colleges, all these different programs. I was looking at Galen, ACC, UT, but the one that caught my attention was Texas State for various reasons. Part was because it was close. Second was the staff. When I went to go speak with someone, I was directed to the health advising. They made time for me. They gave me pamphlets and forms. I talked to them. They told me what courses I was missing, and honestly, the last 2 semesters is what I spent doing. I'm taking the courses that I'm missing for Texas State so I could be able to apply. And I know this is only possible because of the staff. Third, honestly, the environment. This was the first time I was exposed to a public university. So seeing so many people, everybody was so friendly. The vibe, the water, the environment, and then the buildings, it just felt like a real college experience. And that's part of the reason why I chose Texas State. And how did I prepare for this program? Honestly, I've been preparing for a very long time now. The last 2 semesters, I took all the courses that I was missing specifically for Texas State above any other college or university that I'm planning to apply to. And then as a previous nursing alumni to a different college, I have my TEAS books ready. I'm ready to study. Honestly, I've been improving my study habits. I've been improving my mental health because I suffered a lot of my mental health when the last time I was suffering with my grades with my previous institution. The second question reads, discuss a person or incident or experience in your life that prepared you the most to become a nurse who will care for a diverse population of people. So this one hits close to home because in 2021 to 2023, while I was doing all of my prereqs, my grandma suffered from a stroke. Basically, half of her body was paralyzed. She was unable to speak, unable to walk, unable to move her arm, very limited mobility. She was basically a baby version. I don't even want to say like that she was understanding, because at times I don't even think she did remember us. She only spoke through grunts. But throughout this process, I took care of her. I was her advocate because she couldn't speak, she couldn't do anything. So it was vitals, hair care, skin care, medication administration, and food administration via her peg tube because she wasn't able to eat. I was doing physical therapy. We were ordering her gowns because she was so stiff, like unable to move, and we would do the physical therapy, and it was very hard because she was a heavy woman for her age. She was, I want to say, close to 300 pounds, so changing her wasn't an easy task. But we pulled through, me and my family, and we worked to help her get her better and better. But ultimately, towards the last year of her life, her health steadily declined, and we decided to take the choice, right, that she was suffering too much upon the doctor's consultation. So she was put on hospice care, and honestly, she was using an air mask to breathe. We administered oxygen. I made sure, right, air filter, tanks were always filled, no fires, no smoking allowed. Giving her morphine. I was her advocate because no one in my family was brave enough to give her these strong medications because everybody has this negative stigmatism towards these medications. So I was her advocate to make sure she wasn't suffering in pain. And then basically what I'm trying to say is this all ties into the nursing healthcare community. We're advocates for patients who may be drug addicts or drug consumers that are too afraid to get judged, or maybe they get their pain discredited for being previous users. For people who can't speak, who have disabilities, and they can't do anything for themselves, to have nurses advocate for them, to look at those signs of pains, right, wailing, grunting, grimacing in the face, to look out for that. For patients who often get forgotten, right, sometimes I think if we weren't here to take care of my grandma, and she was in a retirement home. I hate to say that sometimes I would think that she wouldn't even be taken care of, right? She would be forgotten because she can't speak up for herself or defend herself. But honestly, that's an experience that basically cemented me into being a nurse and improved me on how to treat others. So, third question. Tell us about your volunteer work life experience. So, during high school, I was in a pharmacy tech program, and basically, we were do rotations at St. David's Hospital. We did a New Haven rehabilitation clinic slash retirement home, and Los Pines retirement home here in Bastrop, Texas. Basically, we were CNA PCTs. We would do vital signs changes, right? The regular feeding patients, making sure call lights. For me, that was a very beautiful experience because those elderly people are often very lonely. Try not to get emotional, but it's true, and I would keep them company. I would talk to them be in regards, right, like apart from my PCT and CNA duties that I had to do for school, right? That helped me prepare for it. So at St. David's, I got to see many students. Right, I saw ACC students, UT students, and that honestly helped me motivate me to keep pursuing nursing. I got to see different work areas, right? A nurse has so many scopes of practice. Anesthesiologist, right? If you get your CRNA, med surge, pediatrics, labor and delivery. And honestly, nurses are like the superheroes, right? They take care of everything. They do everything, right? A little bit of everything. Patient care, cleaning, right? Work, charting. And that honestly, that all of that work experience culminates, and with more of my experience, they just keep going and going, and it just makes me feel like it's preparing me to be a nurse, and that's what I want to do. So the last question reads, recognizing the barriers technology can impose on conversations, how do you plan to overcome those barriers to engage with your patients? So I feel like this is a very COVID question. We all suffered, right? Most people couldn't get their day-to-day care, so they would retreat to like Zoom sessions with their doctors. And honestly, I feel like of someone my age, we're very able to help send resources via iPads, right? Technology to communicate with patients, sending emails, updates, appointments. And honestly, I don't feel like it's a barrier. I feel like it's a step forward to get patient care, especially to those who are in rural areas. And honestly, the only battle we have left is to get these patients the ability to be able to use these technology. Okay, thank you so much for your consideration. I'm ending the video here since I've already hit the 8-minute mark and I don't want to go overboard. So, thank you.